Welcome to the American College of Obstetricians and Gynecologists Video History Project. Today we're extremely fortunate to have Colonel Peter Nielsen here to explain to us a little bit about the Army's program. He's a colonel, but I'm not going to call him a colonel. Call him Peter. Thank you for being with us.
Thank you for the opportunity to share with you, and thank you for your leadership.
Let's get a little information about you. Where were you born?
Yes, sir. I was born in New Orleans, Louisiana, and spent just a few years there before traveling around in a few other states with my father and mother, who were transferred, ultimately landing in Texas and growing up in Houston.
Were they military?
They were not. My father worked for an oil company and was stationed around the country in a couple different places, but when I was still pretty young, we moved to Houston, Texas, and I graduated from high school in Houston, and then I went to undergraduate at Texas A&M University in College Station.
Why did you decide to go to medical school?
Well, you know, in high school I was inspired by my biology teacher, to be perfectly honest. Fascinating field, great teacher, inspirational opportunities in high school to learn. I was fortunate to receive a National Science Foundation scholarship in high school and spent a summer at the University of Iowa between my junior and senior year of high school doing some research and benchtop research there in medicine, and decided that combination of my interest in anatomy and physiology from high school and interest in basic science from my National Science Foundation opportunity at the University of Iowa to go into medicine after studying biochemistry at Texas A&M University.
And where did you go to medical school?
The University of Texas, San Antonio Health Science Center. And
why did you choose that school?
Well, you know, I had been in Houston for many years. My family was in Houston. I had been in College Station for 4 years. Texas A&M was starting a brand new medical school, but like many undergraduates, sometimes you just want to go on to another location after you've been in college for 4 years at one place. And so I was accepted to the University of Texas Health Science Center at San Antonio and decided that that was a great place to live and a great medical school, and an opportunity to be a little more independent and away from my family and grow in my profession and grow personally.
When did you decide you would like to go on and specialize in OBGYN?
Well, that really started during my clinical clerkships in medical school and beginning of my 4th year of medical school. I did a rotation in Germany at the Army Hospital in Augsburg as part of my active duty training rotation in medical school. So during medical school, I was in the Health Professions Scholarship Program. That's a 4-year training program that places you in the Army Reserve during medical school and requires that you do 6 weeks of active duty for training every summer. So the first summer was basic training in Officer Basic at Fort Sam Houston. But my second summer, I was offered an opportunity to go to Germany for 6 weeks. And I went to Germany and went to Augsburg and the military hospital in Augsburg and spent that rotation in obstetrics and gynecology. And it's really there where I spent my time on labor and delivery and in the clinic with Army OBGYN physicians, learning their trade and learning their specialty and their interactions, both surgical and medical, especially with active duty service members and family members overseas, that it really inspired me to not only potentially stay in the Army longer than my obligation, which I ultimately did, but to do obstetrics and gynecology in the Army.
Why did you accept one of the uniformed services scholarship programs?
Well, the Army's training programs were known to be phenomenal, and still are known to be phenomenal training programs for both medicine and surgical specialties. I had an interest in military health care based upon a lot of family that had been in the military previously, either because they were drafted or because they were career officers. And so I ended up being intrigued by the opportunity to be a physician in the military. So I applied for a health professions scholarship after I was accepted to medical school and received a 4-year scholarship from the Army, and thought I would simply take opportunity to take advantage of the training that's available in the military, and then see whether or not a long-term military career was something I wanted to do ultimately, which turned out to be my lot in life, I suppose.
Let's talk about the military. Young medical students comes to you today and says that they're thinking about it might be nice to be a career military medical officer in some branch. What would you advise them?
Well, I would strongly advise them to consider it as an option. Army, Navy, or Air Force, doesn't matter. To me, the training, the camaraderie, the experience, the opportunity to serve both active duty and family members and retirees and their family members just became more than just a job. It really became an honor to care for those individuals. And the camaraderie and the training and the expertise that's available to you as both a trainee as well as a full-time faculty member, either at a training program or in a military hospital, really is second to none. You know, now that I've recently retired and gone into the civilian ranks and work as a civilian physician now, I can definitely say that opportunities for healthcare training, medical training, surgical training in the military, and the unique opportunities for jobs in the military allow physicians to grow in ways that they can't grow and experience as a civilian. And a number of those opportunities come to you just because of the needs of the military, and frankly because of life circumstances and world circumstances and where those things might take you or the unit that you're assigned to.
Well, as an OBGYN, you would be a little different in the military than, say, a surgeon or even an internist. Why would that appeal to a young medical student thinking of a military career that also wanted to do OBGYN?
It certainly seems odd that there might be OBGYNs in the military and have much work to do. And the fact of the matter is that the most common reason for admission to a military hospital is an obstetrics or gynecologic diagnosis. Up to 30+% of the active duty force is female now, and the vast majority of both officers and enlisted soldiers are married with families. And to be honest, the military, now that it has been an all-volunteer force for many, many years, recognizes the value in ensuring that military families are cared for, not just from the aspects of finances or housing or education, but from healthcare. And ensuring that military families are cared for in all environments, in all areas in which the military expects their service members to serve, is really a value added to ensuring that both enlisted soldiers, NCOs, and officers have opportunities to advance, but also have opportunities to remain in the military and retain those officers and enlisted soldiers and NCOs.
We often hear rumors, those of us that are not now in the military, that the disadvantage is that you have to transfer. You automatically have to go from station to station. You can't be in one. Is that a problem, or is that just a argument that people use?
Well, I think people feel like change can be difficult, and that's sort of a human nature characteristic. But the way that many people need to look at change and look at opportunities to be assigned to different locations can ensure your success or can result in a good attitude or a bad attitude. And my advice to folks considering joining the military and doing military medicine is to look at every assignment as an opportunity to learn from someone else, to learn from a healthcare system or a healthcare opportunity or a healthcare region that's going to be different than where you may have grown up in healthcare as a medical student or as a resident. But most importantly, the fact of the matter is that the assignments that you get in those places are finite, typically 2, 3, 4 years at the most. And so taking advantage of not only learning from different people that you might get exposed to there, learning from different leaders that you might have, good, bad, and also taking advantage of the environment that you're in, learning about the area, learning about the people, whether that's different parts of the United States or whether that's different parts of the world. And so I think part of the uniqueness about military medicine is that it can provide you with opportunities to learn from different people trained in different places who live in different places, and you can get that exposure and experience over time, and you're not tied to a particular place for a long time, but ultimately you can decide after you're eligible to get out of the military where you might want to consider living. And some of the places that many of my colleagues were assigned and considered as potentially not the most ideal places that they wanted to go, ultimately got out and now are still living in some of those places.
Well, when you get out, is there a problem of adapting from the military to civilian type medicine?
Well, I think that because our training programs are so much consistent with civilian training programs relative to the expected trainees' knowledge and attitudes and behaviors and skills, that really the basis of the profession and the practice of the medicine really isn't any different. The environments are different from the perspective of payment types and hospital engagement and hospital relationships and in clinic relationships, but the basic practice of medicine relative to obstetrics and gynecology and the care for patients really isn't a transition issue of any sort of a problem. The issues centered around how you interact with hospitals, how you interact with practices, and how you may be reimbursed certainly is different, but as more and more physicians become employed now, as opposed to being in private practice, much of the way your practice was in the military is going to be, frankly, more like civilian practice and not less.
You've been an active member in ACOG for a long time. Why do you see that the military OBGYNs should belong to an organization like ACOG?
Well, I have to go back to my residency in El Paso at William Beaumont Army Medical Center, where I had 3 mentors who very early on clearly provided not only guidance and education around healthcare and OBGYN technical skills and decision making, but also relative to leadership and relative to the importance of belonging to a national professional society and organization like ACOG. Those individuals, now retired General Kiley, retired General Holly Bolin, and retired Colonel Cesar Rosa, were key and instrumental to me in formulating not only my professional future, but my attitudes towards joining and becoming a potential future leader and a future leader in an organization like ACOG. The reasons stem from the fact that ACOG is the premier women's healthcare leader in in the Americas and in the world, for that matter, and taking on opportunities to both help be part of that organization and potentially lead parts of that organization as an armed forces member make you part of a larger global community of physicians that are caring for women. The other reason is that you can bring unique insights into the challenges and the benefits to caring for active duty service members, retirees, retiree family members, and active duty family members to the forefront of an organization which is largely civilian trained, civilian practicing OBGYNs. And because so many active duty service members and retirees get health care outside of military hospitals in many cases, because those hospitals may not exist, it's important that the messages around some of the practice challenges and care challenges for those members of the armed forces and their family members are made clear to all ACOG members. And that's the most important reason why I think members of the military who are in OBGYN need to be actively engaged in ACOG to ensure that the ACOG as an organization can see that component of their professional members' activity and help influence activities and decisions that they make in the context of healthcare for military family members, retirees, and veterans.
What recommendations would you give to ACOG in terms of its relationship with its armed forces members?
Well, I think ACOG does and needs to continue to see its relationship with its armed forces members as an enormous value added to their organization. One of the intriguing things about the armed forces and the Armed Forces District in particular is the fact that so many of our physicians, both in residency and those that are now staff physicians, have grown up quickly and been required to be leaders earlier in their career than most other civilians in training or those that have graduated from civilian training and are now civilian physicians. And part of the reason for that is just expectation. The military expects its young officers to be leaders much earlier with much more degrees of responsibility for both financial as well as people and being in charge of people than most civilian organizations at the same level of age and experience. And that leads to an enormous cadre of young, experienced leaders that ACOG can utilize in their own organization for the benefit of the organization and for the members. And I think that it's been very clear to me that most of those individuals that we have grown and developed into leaders in the military have become very strong, not only advocates for ACOG, but have become very strong leaders in ACOG, both during the time that they're in the military and following their separation from the military, whether that's doing their service obligation and leaving, or whether that is doing an entire 20-plus year career and then retiring.
One of the interesting things about the demography of ACOG is the large number of women that are now, we know 80% of our resident trainees are women. What impact do you think that will have on the recruitment of OBGYNs into the military?
Well, that's a great question. You know, military training, residents in military training have seen a change in the demographics of that population very similar to what's happened in the civilian world. About 80% or so of military OBGYN physicians are female. And I think that while that does change the demographics of that and does change some of the dynamics of those training programs, I think overall it has not seemed to adversely change any of the opportunities for those women to both remain in the military, remain as active leaders in the military, as we've seen from several senior women leaders in OBGYN, including General Carla Hawley Boland, who was the first female medical corps general officer ever in the history of the United States military. And so she's a leader in that regard and has led the way for many other female OBGYNs in the military to continue to serve at very high levels of leadership in the military and then beyond their service in the military.
Once you finished your military commitment, be it short-term or long-term, what is the future for the physician that has been in the military the whole time? What kind of a future do they have to look forward to?
Well, I think they have a very bright future. I think the opportunities that the military gives physicians at any age and development portion of their career provide them with a significant advantage over many people in civilian communities, simply because they're put in positions of leadership much earlier, and they're put in positions of responsibility outside of simply the nuts and bolts of doing obstetrics and gynecology earlier, which forces them to both learn quickly and adapt quickly, and makes them much more versatile in adapting to change outside of the military and in civilian practice. And just in my short time after having been out of the military, as I've been responsible for helping to grow a new practice in an area of the country that's not had a lot of these resources available to them, I've looked, to be honest, to military trained physicians as a serious opportunity for them to have leadership jobs where I'm interested in having them work, because I know that their qualities of leadership, their qualities of service, and their qualities of dedication to a mission are paramount. And I think that those kinds of characteristics are what any organization is going to be strongly interested in hiring. Physicians who have a keen sense of mission, a degree of experience in leadership outside of the traditional technical aspects of their jobs is really what medicine in general needs. And the more opportunities you have to gain those exposures, the better off you'll be. And I would say that the vast majority of OBGYN physicians in the military are seen in that light relative to their separation from the military, and they're seen as potential leaders or future leaders in any organization that they have an opportunity to work for.
One of the things that always comes up when you're active in any type of organization like ACOG is the commitment. Have you personally ever experienced any problem being active in ACOG because of your military background and military commitment in terms of the time you have available or the ability to do things?
I have not. And I know many, many other armed forces members who have not had any barriers provided in front of them to participation in ACOG or ACOG activities. The only times in which I know that there may have been conflicts that were impossible to resolve were times in which our individuals were deployed to combat, both in the first Gulf War and in the second Gulf War. But organizations like ACOG and many other our professional societies certainly understand those commitments and opportunities to substitute out individuals for important activities in the United States that are necessary to accomplish for ACOG certainly can be covered by someone else when an individual is deployed for 6 months or a year.
Hopefully we will not have another time when we have two serious confrontations, let's put it that way. I'll be gentle.
Hopefully not. Hopefully not. But you know, ACOG service members in general have served readily in all of those conflicts, really, since the Gulf War I and on through the second Gulf War. More than 300 active duty Army officers and reserve officers called to active duty that are OBGYNs have served in either Iraq, Afghanistan, or Kuwait since the early 2000s.
Well, obviously, we think our Armed Forces District is one of our strongest districts. And I really appreciate you being here today to explain all of this. It's almost like a recruiting visit, but that's perfectly all right, because I don't think many of our members fully understand our Armed Forces District, what the commitment is, but how well they can work within the system. Peter, thank you very much. I appreciate your short notice. You came and you answered all the questions exactly like I thought you probably would.
Well, thank you, sir. It's been an honor.